wipe from front to back. If they wipe the other way, what are we potentially doing is introducing the E. coli that's normally in your stool or around your rectum into your urinary system. So E. coli, just remember, is one of the common things that creates a UTI because it's there in that area of the body normally, but once it enters the urinary tract, it creates an infection there. Untreated UTIs can lead to polynephritis. We just talked about what that is, infection of the kidney itself or the renal pelvis, that's that large section of the kidney. Untreated UTIs can lead to this, and the patient can become something called uroseptic, and we talked about what that means. That means that there's an infection that started in the urinary system. It's now traveled and been able to enter the bloodstream because it got so bad we didn't treat it, and now the patient can go into septic shock and death. So untreated UTIs are a big deal, particularly in older patients because they get sicker quicker. So we have to recognize the signs and symptoms of UTI, particularly with our older female patients. And here's the reason why. What puts females higher risk than males? What did we just talk about? Wiping from front to back. Obviously, the anatomy of a male doesn't allow that potential bacteria to enter into the male as easily as it does the female. So your older adult females are high risk for UTIs all the time. Because they're older, they forget to wipe the right way. Maybe they don't wipe well at all. Maybe they don't keep themselves clean in the perineal area. So they're higher risk for UTIs. And how do we recognize that? By those signs and symptoms of confusion, the changing. They're not eating. They just don't seem like themselves. They might feel a little bit nauseous. They don't always get that painful urination. They get other things first. And that's kind of how their body reacts. So the important part is untreated UTIs can lead to polynephritis and urosepsis, and that can result in septic shock and death for the patient. So who's at risk for a UTI? Females rather than males. For obvious outside reasons, E. coli can be introduced easier for a female, particularly if she doesn't wipe front to back. The urethra, that's the tube draining from the bladder to the outside, is shorter in females. Because of that, little girls who are 4, 5, or 6 are more risk than little boys who are 4, 5, or 6 for UTIs. Their urethra is shorter. So what does that mean? That means any bacteria that is introduced into their urethra can travel into that urinary tract system quicker. So a couple different things happen. Females are more risk for wiping reasons and genetically anatomical reasons. Urethra is shorter in females, so that makes them more likely to develop that infection because that bacteria can travel quicker up into that bladder and into the urinary tract. People that are sexually active, higher risk for UTIs. Obvious reasons. There's an introduction of sex for that patient. What do we tell people? Avoid before and after, so that you flush out any bacteria that potentially could have entered into your urinary system when you had intercourse. That's bottom line. That's the facts. Sexually active women. Frequent use of feminine hygiene sprays and tampons. So while we think those hygiene sprays are good, they're not always the best thing. Why not? Because they change the normal flora that's there in our vaginal area and in our urethra, in our bladder, and that normal bacteria, those sprays can create more of a likelihood for those infections to develop that maybe weren't going to develop in the first place. So the hygiene sprays, be very careful with. Obviously, tampons. Again, not changing your tampon frequently enough. I'm not trying to get into everybody's personal space here, but these are things that we have to think about that make people higher risk for UTI. So females, sexually active women, somebody that frequently is using hygiene sprays or tampons, or maybe doesn't stay clean perineal-wise, somebody that's postmenopausal because they had decreased estrogen. So there's your older adult lady that's postmenopausal and has wet, and her estrogen supply is low. There's your patient with a catheter in. Aren't they going to be higher risk for UTI because we have a tube going into their bladder and it's an outside source and a way for bacteria to enter? People with diabetes, higher risk for UTIs because their sugar Being high creates a higher likelihood of bacteria developing. Again, there's that decreased estrogen level. People that are pregnant, higher risk for UTIs, and UTIs in pregnancy are a very big deal because if the mom gets sick, what could potentially happen? That uterus could get involved and get infected as well, and then the baby has lots of issues. So pregnancy is a huge deal for UTIs. We tell moms when they're pregnant, always report any signs and symptoms immediately. Can people that are pregnant take antibiotics? Yes, there are safe antibiotics for those people to take. So that's what they would be taking in order to get rid of the UTI. What do we want to tell people to decrease their risk? Wear cotton underwear, that's okay. Polyester, what's it going to do? It's going to keep that area even moister. Pantyhose, not many people wear them anymore, but they used to. Obviously, higher risk for infection because it doesn't let the area air out. And then wet bathing suits. So what would we tell little girls after they get out of the pool? Change your bathing suit. Don't stay wet. Any kind of wet, moist area, go back to what we learned in infection control, isn't that going to be an area where there's more likely for a bacteria to grow? What are bacteria like? Warm, moist, wet areas. So that's what we're talking about here. So keep the area dry, take that bathing suit off, wear cotton underwear, no pantyhose. If the patient's diabetic or higher risk, all of these things we can write on a note card, but we have to think in our head what's creating this happening, what's creating the higher risk for somebody to have a UTI. So here's our signs and symptoms.
Excuse me, Miss Anderson, the PowerPoint not moving.
It's not moving?
No, we're all seeing the first slide.
Okay. Let me start it up again. Is it moving now?
Yes.
Okay. So here's our first slide. This is what you've been seeing the whole time?
Yep.
Oh boy. Okay, so here's our second slide. Here's our three parts. We talked about the function of the urinary system. We talked about what a urinary tract infection is. It's an infection of the urinary system. We talked about what polynephritis is, infection of the kidney itself. Urinary tract infections, we just discussed that E. coli is often the most common cause. So when you get a urine CNS and it says positive E. coli, don't be surprised. That's what it's normally going to be. Could a patient have a urine culture and sensitivity? It could say staph. Yeah, it could say staph. It could say strep. It could say pseudomonas. It could say anything. But many times E. coli is a gram-negative bacteria, and that's how it's going to show up. And we talked about untreated UTIs can lead to polynephritis and urosepsis, and the patient could become septic. So here's your PowerPoint about who's at risk for UTIs. And we just talked about females for wiping reasons, anatomical reasons, plus their urethra is shorter. Sexually active women, frequent use doesn't mean you can't use them, but if you use them constantly, it's going to change and create an environment where you could be potentially making more bacteria enter than you are doing good. Frequent use of tampons, and particularly if you're not taking your tampon frequently enough. Spermicidal jellies, frequent use of them. Postmenopausal women, people with a catheter, people that are diabetic, elderly people, people that are pregnant, people wearing polyester underwear. Recommend that they wear cotton because it keeps the moisture away from the patient's skin. Wearing that wet bathing suit. So when you get out of the pool, for little girls, go change your bathing suit so that you stay dry and you have less likelihood of developing a UTI. That really is true. Okay, so here's our signs and symptoms. Lower back pain, nausea. There's that dysuria, painful urination. That's what it means. The patient has urinary frequency. If you've ever had a UTI, you know exactly what you felt like. You felt like you were peeing constantly, but then couldn't really drain your bladder. It's painful when you go. They could have hematuria, so they could have blood in their urine. What's pyuria? Pus in their urine. When you get a urine sample for that patient, what do we say should be in normal urine? Should we have white blood cells? No. Should we have glucose? No. Should we have ketones? No. Should we have bacteria? No. If it says less than 1,000 bacteria, that's okay. But if the CNS comes back showing gram-negative organisms in the urine, you're pretty certain that they have that urine infection, E. coli. The other thing that you might see is positive leukocyte esterase. That means that there's likely to be a bacteria growing in that urine. It's an indication of a UTI. And certainly cloudy or foul-smelling urine. So those are the signs and symptoms that the patient would have if they had a UTI. And again, older adult patients look a little bit different. Why is an older male at risk for UTIs? They might have an enlarged prostate. What is that enlarged prostate doing? It's preventing them from completely emptying their bladder. So what do we say about when people, older patients in particular, need to pee? Even if it's every hour, every 2 hours, we encourage them. As soon as you feel the urge to void, go void. Don't hold it in. Sometimes if we're in class, or let's say we're at work, or wherever we are, and we're saying, okay, I can wait, or I can hold it. All that's going to do is increase the risk for their likelihood for the UTI. So older adult patients, male patients, enlarged prostate puts them at risk for the UTI. Obviously, having poor hygiene puts a male or a female patient at risk for UTIs. And again, inability to empty their bladder, same exact principle. We want to tell them empty their bladder as frequently as they can. Try to get that bladder empty so that the urine is not sitting there. The urine sitting in their bladder longer only creates a more likely risk that they potentially can have that urine infection develop. Here's our symptoms in our older adult patients: confusion, loss of appetite, nocturia, meaning that they're getting up 3, 4, 5 times at night to pee because they feel that urgency to pee. They have some of those same symptoms of frequency and urgency, but they may not have that lower back pain. They may not have, white blood cell count go up right away. They may not have hematuria, but they have a lot of these other symptoms. And this is just your older, elderly patient. Particularly females, remember, are going to be higher risk. But it doesn't mean males can't get bladder infections or UTIs as well. So we know the patient has a history of BPH, or benign prostatic hypertrophy. What the heck does that mean? That means their prostate's enlarged. Increases their risk for UTIs because they can't empty their bladder. Somebody that has diarrhea all the time, don't you think they'd be increased risk for UTIs? Why? Because they have frequent incontinence of stool and they're sitting in stool. So that's why we're always constantly talking about make sure you toilet these patients or get them to the bathroom every 2 hours. Make sure if they are incontinent, we're changing them at least every 2 hours, if not more frequently. Because them sitting in that stool that they're incontinent of, it might not be their fault, only puts them at higher risk for developing a UTI. Because for obvious reasons, they shouldn't, if they're sitting there with stool and they're attends, aren't they going to be higher risk for developing a UTI? So always make sure good perineal hygiene. If they're incontinent of stool, we should be thinking increased risk for a UTI because the stool is sitting there and can potentially travel into the urethra and into the bladder. A patient that's older, they have less nephrons that are working. What's the nephron? It's the filtering unit of our kidney. So if it's not filtering as well, more likely to develop issues with that. Inability to empty their bladder. That might be your neurogenic patient. That might be your Guillain-Barré or your ALS or your myasthenia gravis who is having neuro issues that are creating the bladder can't fully empty. So always be thinking, encourage your patient to empty their bladder. Encourage them to get up and pee. As soon as they feel it, the urge to pee, well, let's get to the bathroom and try to pee. Even though we think, oh my gosh, I got 18 other patients, we still should be promoting this so that they don't develop UTIs. And then here's some of their signs and symptoms that are listed here. So here's our nursing care. What are we going to tell our patients to do for somebody that has a UTI? Promote fluid intake up to 3 liters. What's our normal fluid intake that we want to have people take in? Usually somewhere about 1,500 mLs to 2,000 mLs. That's normal every day, how much we should be drinking. Does everybody drink that much? No. Do older patients always drink that much? No. But your utopia answer is promote fluid intake up to 3 liters per day, or even more. Drink more, drink more, drink more. Why? Because you want to flush out your kidneys and flush out that bacteria. Antibiotics. What do we tell people about antibiotics? Well, if you have a UTI and you start on antibiotics, anybody ever had a UTI knows after a couple of days you start feeling a little bit better. Some of those painful symptoms go away. Maybe you don't have as much urinary frequency. Maybe you're not noticing blood in your urine anymore. And then sometimes what might happen, you might stop taking the antibiotics, and then what do you think is going to happen? The bacteria is going to come back. So always tell the patient with a UTI, particularly the pregnant patient who I said is at higher risk for complications, take the antibiotics through the full course of the antibiotics. If it's 7 days, take 7 days. Even if you start feeling better after 3 days, keep taking the last 4 days so that you get rid of any bacteria that potentially is still there. So take the antibiotics as prescribed for the full course. Encourage a client to urinate every 2 to 4 hours. Don't wait until your bladder's full. Let's get you up and empty your bladder frequently. And you almost can put them on like a bladder regimen where you're saying, let's go to the bathroom more frequently. Let's empty your bladder. Let's get rid of any bacteria that potentially is sitting there. So that's okay. You might even have to like write this down. Bladder, I don't know what the word order usually says, but bladder regimen every 2 hours. So even if the patient says, I don't feel like I have to go, well, let's just go see if we can empty whatever might be in there. Warm sitz baths are okay for comfort if the patient has a perineal infection that's created this UTI. But remember, we don't want this patient sitting in that tub of water for too long. The sitz bath basically is just water that's flushed over the perineal area. Don't recommend that this patient sit in a bathtub for a long period of time because sitting in a bathtub puts you at higher risk for a UTI. Recommend they get a shower so they're not sitting in that water. The sitz bath, all that really is warm water that's flushed over their perineum, kind of like a female pregnant patient that has hemorrhoids or has an episiotomy. We use sitz baths for that. So don't recommend bathtub for these people with a UTI. Recommend a shower. Avoid the use of indwelling catheters if we can, because there's one of our risks. So get the catheter out as soon as possible. Pregnant patients require immediate and effective treatment of a UTI because if it becomes polynephritis, what now is that? That's an infection of the kidney itself, and the patient can get very sick, and the baby is affected by the infection because the mom's very sick. So UTIs in pregnant people are very serious things. It's not a minor thing; it's a serious thing because if they develop a kidney infection, potentially their blood pressure could go up, and we potentially could have to deliver the baby too early. So that's our biggest complication, preterm labor. Always tell the patient wipe from front to back. Avoid baths, feminine products, toilet paper containing perfumes. Just use regular old toilet paper. Anything that we know is going to increase the risk of changing the normal bacteria that's in our perineal area or introducing something that our body is not used to, and that's the toilet paper containing perfumes. It smells great, but may not be the best option for that patient. Avoid sitting in wet bathing suits. Avoid pantyhose or tight clothing. Okay, and then here's talking about polynephritis, and then we'll be done. Polynephritis, what is it? It's an infection within the kidney itself. Who's at risk for this? And again, the same stuff is in your book. I would read through it. I'm just trying to cover it in a nutshell with the PowerPoint. But read through these chapters today. A male patient older than 65 with prostatitis. What's that mean? Inflammation or enlargement of the prostate. Somebody with a spinal cord injury. Somebody has a spinal cord injury above us. We haven't talked about spinal cord injuries yet, I don't think. But above, remember, cervical, and then we have thoracic, and we have lumbar. Anything higher than the bladder itself, so that's lumbar and thoracic, that's pretty much all different spinal cord injuries can affect our ability to empty our bladder. So your spinal cord patient, because they can't pee on their own, and can't empty their bladder, they're always going to be at risk for UTIs. They're always going to be at risk for polynephritis because their bladder tone and their bladder signals aren't the same anymore. The spinal cord injury prevented the signal from our brain to tell our bladder to empty. What do people with spinal cord injuries have to do? Many times they either have to have an indwelling catheter or they have to frequently get straight cath themselves or somebody else that is taking care of them, and that's going to always put them at risk for this. Pregnancy can be a risk for polynephritis, having a bladder tumor, and incomplete bladder emptying. So basically what is polynephritis? It's an infection that has now become more than just a urinary tract infection. It's an infection in the kidneys. Here's the people that are at risk. Here's the signs and symptoms. The patient has a fever, they have a high white blood cell count, they have chills, they have abdominal pain, they might have tenderness in their back, because that's where our kidneys are, right? In the flank area and on our back, so their kidneys are infected. So that's where you're going to see their pain the most. And of course, they have burning and urgency and pain with urination. That doesn't change. But the thing that we add to the polynephritis is more like that flank and back pain, because that's where the kidneys are, and the kidneys are infected. So here's our tenderness. Costovertebral angle is what it's called. And this is basically the back of the patient. And when we palpate or we put any pressure where the kidneys are, that's very tender for this patient because the kidneys are infected. The kidneys are involved. It's not the urinary tract now, it's the kidneys that are infected or involved. So what's our treatment for this? IV fluids. Many times this patient is on IV antibiotics because they're sicker than the UTI patient. So maybe PO antibiotics are not going to work. Rest for this patient. If we can't clear up the infection, we might actually have to take out one of the kidneys. That's a nephrectomy. If there's a kidney stone creating a blockage, we have to remove the kidney stones. And again, if it's severe, IV antibiotics might be needed. So there is a difference between UTIs and polynephritis. Obviously, polynephritis is worse. It's an infection within the kidney itself, and the symptoms are a little bit worse. Costovertebral tenderness is one of the things that you might see on ATI, and all that really is tenderness right here. Below the last rib is something called this angle. That's the costovertebral angle if you're looking at this side. And that's in the back of the patient, right below the last rib. They have tenderness back there, and that's where our kidneys are. That's why the tenderness is there. So here's our treatment for that. And then tomorrow we'll talk about kidney stones. We won't go any further. Any questions about UTIs or polynephritis? Yes, no, everybody good? Anybody still on here?
Yeah.
Yes.
Yes.
I'm like, has everybody went back to watching TV or went to sleep? Everybody's still on here. All right, so,
Yes, we're here.
okay, good. All right, it's hard for me to tell because I can't see you. So honestly, I'm going to say it again. Zoom is only as good as you make it, and if you pay attention and take notes. If you're sitting there like on your phone, you're not learning a thing. If you're running around your house trying to listen to me, you're not learning a thing. So try to make it as good as you can make it, because remember, you're the one that's got to pass NCLEX in July. And this is what we did from March till June, and it's awful. So